Thank you for sharing your time with us this morning. We hope that this information can be of value for you as you struggle to kind of navigate this new maze known as the Affordable Care Act. I'm sitting here this morning in the heartland looking out my window, and it looks like there's a storm rolling in, and I can imagine as business owners we all feel the same way as we try and approach this issue, especially this law, as it feels like a storm with all of this uncertainty that we don't really know how we're going to handle. More information for you today. Brian, can we go to the next slide, please?
Yeah, sure.
So we wanted to put a little bit about information in this presentation to kick it off, because that's essentially what ED Bellis does. We provide information that's reliable and valuable to people and help them navigate like this, move through the compliance, and we feel that providing people the right information make the best decisions that are needed, because if you advance to the next slide, you will see that when there is a lack of information, a lot of things start to come up that don't necessarily hold any truth, and that's where myths and disinformation and other things come out. And as I deal with how my job works, I look at how 10% of my job breaks down is to essentially clarifying myth, disinformation, and everything, and helping people who are still in the dark figure out these things. And so we're glad that you're here. I'm going to hand it over to Brian to get into some of the meat of the things, and then we will update. After his remarks, we will update you on the latest developments and then talk about the pay-or-play analysis, what we're seeing businesses do, and the two thought processes that we believe are most important. So, Brian?
Sure. Thanks, Sean. Like Sean said, people are still in the dark regarding the marketplace or exchanges. Those terms are used interchangeably. And in the absence of good information, people do have to make things up. We're just a couple of months away before the exchanges are set to go live, and they are the cornerstone of the largest public policy change in a generation. And they will change fundamentally a large portion of our economy. But we are still in the dark due to the lack of information being released by the federal government. I think they are working on a timeline and releasing as much information as they can, but the timelines are pretty narrow. And carriers also are very tight-lipped about the rates and plan designs and things in the marketplace because of risk of adverse selection and market-based decisions. So there's a tremendous amount of uncertainty regarding the marketplace's functionality, affordability, sustainability, and efficacy. So the problem is a lack of information. However, there is enough information for businesses to make decisions, and we're going to be going over that today.
I always like to say this next slide, because of this lack of information, I call it the ACA Bigfoot of American law, because more people believe in Bigfoot, haunted houses, or aliens and believe that this law actually is a real thing. And a key point to remember is beginning next year, everybody in America is going to have health insurance due to the individual mandate. The employer mandate was obviously delayed, the enforcement of it for 1 year, but remember that individual insurance will still become prevalent, and it's important consideration. Next slide. Okay, here are a couple of updates since we've probably last spoke. I encourage you to check out healthreformexplained.com. That is our website, and we have regular information every day almost updated on there. Open enrollment begins October 1st of 2013, and now that's when these new marketplaces begin, but that's also where you're going to see individuals without insurance filling out applications to try and qualify for premium tax credit subsidies and other things to be able to purchase health insurance. That will begin January 1st, 2014. An important point for you to note is that this first open enrollment period is longer than the ones that will be in subsequent years. And the reason behind that is they want to get as many people on the plan as they can this first year. And so the open enrollment this first year will be October 1st until March 31st, so October 1st, 2013 to March 31st, 2014. And then in subsequent years, it will mirror Medicare Part D, and that will be October 1st through December 7th. And so it's going to be important to be out in front of this issue, measuring your employees, because that's going to be very important for certain industries like the ones that we're essentially working with today. Next slide, please. I spoke to the individual mandate. I think everybody knows, but an important point I wanted to bring up is this issue of these advanced premium tax credits. And people that make up to a certain amount, those that make up to 250% of the poverty level get extra assistance, and they're able to apply for some of that assistance in advance. And the regulations delaying the employer mandate relaxed some of those essentially checks and balances for those individuals, and so there could be a lot of folks going to get a benefit that they may not necessarily qualify for. They may lie about their income or other things, and that's going to be a big mess for the public to handle, and it could be challenging for businesses as well, because this employer mandate again begins January 1st, 2015. And the feds in their transitional documentation are encouraging employers to voluntarily comply in 2014. And so we're going to present some ideas here in a second, some ideas that you should be following here in the next 18 months to make sure that you're not going to get caught behind with what's coming down the pike in 2015. Next slide, please. I put this slide in because it's the dog days of summer, if you will, for you baseball fans. But I wanted to give you an idea of how inefficient the federal government is essentially in enforcing and handling some of the deliverables in this law. Now, everybody hears how this law was a 2,000-page bill, and it was actually not quite that long, more like 600 or 700 pages. But the problem is it was an outline, and almost 1,700 times in the Affordable Care Act, they give the authority to the executive branch to do something as minuscule as developing a report for Congress to creating a health insurance exchange, which is obviously the largest technology cost in U.S. history that's not related to the Defense Department. And they're about on time 32% of the time. So in baseball terms, that's pretty good. But in the grand scheme of things, that's not. And you'll see as more and more delays come out, it's because the federal government simply is not built to be able to handle some of the strains that are put on it because of the Affordable Care Act. I would note that of the things that they are on time, they happen to be the new taxes in the law. When the IRS official in charge of enforcing that was pressed at a Ways and Means hearing, he assured that the IRS is on target. But as far as some of the consumer protections and other things in the law, they're still trying to figure out how to make it all work. And so that's something to pay attention to. And as we get into this decision crunch time, how do you best make the decision? And we understand that it's completely overwhelming, and you folks go into business because you're passionate what you do, and the last thing you want to do is struggle with having to learn a whole new law. But we're here to help you with the rest of the content of this newsletter, and we will be answering your questions very, very shortly. After I think, Brian, it's you're up to go through your process as far as the two scenarios, pay or play, how to kind of understand navigating that decision, what you should do when you make that decision, and then how to move forward. So, Brian?
Thanks, Sean. And by the way, if anyone has any questions, there's a little balloon icon that you can click and type your questions in that chat box, and we'll save some time at the end to get to them. But moving forward, obviously, we are here to help you on the bottom of this line to mitigate the things about the law that you cannot change, to assist you at changing the things you can, and providing you with the information to know the difference between those two. And that's kind of how we look about our position. I'm going to move forward. Sean, before I continue, you want to cover this official employer report real fast?
The official employer report, this is something to put on your radar. There hasn't been adequate information come out, but during a Ways and Means hearing that I touched on a couple minutes ago, it would have been about 2 weeks ago, they had the two officials in charge of enforcing the Affordable Care Act. So very, very important individuals as far as understanding how this is going to work. And they kept talking about this official employer report. And what I've found in my research is this official employer report will be on your taxes in 2016. And it's going to require all employers to list how many employees they have, whether or not they offer health insurance, and a bunch of the other requirements under the law. And so that's why they're encouraging people to start thinking about these things, thinking about your business in 2016. How many are you going to be employing, and figuring out kind of your approach, because 2016 tax season is kind of a hard deadline that they're throwing out there that we wanted you to be aware of. And we have more on that on Health Reform Explained. So thanks, Brian.
Yep. So how do you make a decision on whether to pay or play? And after you make that decision, what's the process to implement that decision? What are the things you need to be concerned about? And we're going to outline that for you. So the way we see the decision-making process is the first thing you have to do is get the information you need to make a right decision on whether you are going to either keep or establish a group-based health insurance plan, or send your employees to the marketplace to access coverage through that vehicle. Now, whatever you do decide, employee communication is going to be a huge factor. Obviously, employers are wanting their employees to see that the company cares for them and the company has a vested interest in their health and well-being. So we're going to put that in the bigger picture as far as your human capital management. Whether or not you choose either way, obviously there's going to be some compliance issues. And we're going to go over some of the big ones. There are some very important things that we need to touch on with that. So that's the process that I'm going to take you through today. And, of course, the first is the pay or play. Companies of all sizes are going to have to conduct a cost-benefit analysis. What we have found at ED Bellis when we do these, most are not in as bad shape as they anticipated. However, they're going to need a strategy because of changes evolving in the law. The research that you do now is changing and evolving. Right here in the middle here, this is a key one here. A pay or play cost-benefit analysis can be completed. It's based on your employer data and your employee demographics combined with a health insurance market study. And it can only be done using your company's specific data. Informed decisions can't be made based on what other people are doing or anecdotal information. It really is a one-on-one measurement of your situation. But again, it is driven by the size of your company, how much your employees make, and the industry and benefit structure that you're in. In some cases, it makes better sense to pay the penalty. And that is because if your employee's salary is low, the cost of providing affordable coverage, which is the amount that the employer has to subsidize to reach a certain level, is greater than the penalty of not providing coverage at all. So there is a break-even point for an employer, and also a break-even point as far as the employee's premium in the marketplace versus the premium in your group-based plan. So you have to find that break-even point. A lot of employees in blue-collar industries and a lot of the industries that we're working with are actually almost better served in the marketplace because of subsidies. And then also, if their income falls below 250%, they also receive help with their out-of-pocket costs. And this is how it looks in the marketplace. So if you're under 133% of federal poverty or 100% of poverty in our state of Nebraska, because we did not expand Medicaid, but some states have, you can receive help through that program. And up to 250%, you get advanced premium tax credit and cost-sharing reductions to help you with your out-of-pocket costs. And those are scaled to the point where when you reach 400% of federal poverty level, which is over $90,000 for a family of four, then you pay the full cost of insurance. And that's the marketplace in a nutshell. So once you've made that decision, what does it look like, and what strategies and considerations should you be looking at? So let's cover first if you're going to pay the penalty. If you do decide to send your employees to the marketplace, the main strategy that's going to be in play is to minimize the penalties that you are going to pay, which is $2,000 per employee per year. And you can make your company look as small as possible to the government. And there's no one golden arrow as far as to make your company appear small. It is many small areas that need to be addressed. So we're just going to cover on what they are just because of time today. But there's plenty of information, like Sean said, on our website. And feel free to contact us, and we can provide you with a little bit more information. The first is establishing the right look-back period. That's basically the measurement period of when the government's going to hold up their yardstick to measure how many employees you have. The next is to onboard employees as variable or part-time. You can actually, depending on the attrition in your industry, significantly reduce the size of your company in terms of the law by establishing a long variable initial measurement period. You can use temporary employees. You can use part-time employees. It's unfortunate, of course, that so many companies had to reduce their employees' hours to under 30, and then the mandate was delayed for yet another year, and they had made a pretty hard business decision as far as human resources that ended up not paying off in the end. But that is going to be a strategy moving forward. There are multiple other strategies that are out there that take a little bit more care and due diligence because there are compliance issues. That is with 1099s, with leased employees and employee sharing. Those can be used, but they have to be used within the confines of the regulations and the law. So that's if you send your employees to the marketplace, your major considerations. But what if you decide to play along? Well, play along, we mean establish a group-based plan. Well, employers are going to be operating in a new environment in 2014. A lot of employers have already received their renewals already, but a lot of them are going to see the renewals that they've received right now are based on their current market functions. So they don't have the health insurance marketplace or the Affordable Care Act's mandates in them quite yet. But they will come in 2014, and they are expecting a lot of companies to experience what we call rate shock. That is because right now, if you are healthy or young or a male-dominated workforce, then you're actually getting credit for all those aspects. But that's going to go away because the companies will be subject to a community rating. It's under 50 now, and then it will be under 100 employees here later on. There will be several new mandates and taxes. You can also, if you're a small employer, choose to participate through a shop exchange. That is going to be a market-based type plan. And if you do decide to go to the shop exchange, you can receive a premium tax or a tax credit as an employer. So you could actually receive a credit based on how big your company is and how many employees that you have. If you do offer group-based coverage, of course, you do get a pretty good tax advantage because they are made with pre-tax dollars. However, in the marketplace or exchange, all premiums and penalties are made with after-tax dollars, so you have to talk to your CPA about that. This is the marketplace reforms in a nutshell. These are why kind of premiums are going to be going up for some people and down for others. There won't be any premium rating or denials based on health status or gender. And there will be really big limits on how much you can charge an older person compared to a younger person at a rate factor of 1 to 3. There will be a single risk pool, so there won't be any advantage for being a healthier group. We're all going to be put in one basic demographic, one pool that's going to be based on location. Depending on your state, it may be different. It may be a city or a zip code or something like that, but it will be based just simply on your location. And that coverage is going to be guaranteed to be available and guaranteed to be kept and renewed with When it says limited exceptions, but that's really only if you move out of the area. So that's if you play along with the Affordable Care Act, but there is another option of playing by yourself, because some people, I guess, don't play well with others, and that is talking about self-insurance. There has been a dramatic rise, in some places a 6,000% increase in the percentage of employers that are using a self-insured business model over the past 12 years. What that means is that the employer actually is responsible for some of the claims costs, and you can limit that based on different kind of insurance programs, but it's not a premium-only plan. So you are combining a premium for like a stop loss combined with some claim exposure. It can be designed to look pretty much exactly like a fully insured plan, but what it does is allows you to avoid the community rating. So with all those marketplace reforms that we talked about, if you are self-insured, you can bypass them. And you can also have a flexibility in plan design, so you have much greater ability to decide what that cost sharing is going to be, and what services and programs that the plan will pay for, of course, within the confines of some regulations. But you do have the ability to control costs. You can actually see, to give you an example, there may be a drug that costs $5,000 at one location and $2,000 at another. It's amazing, but the ability to control those costs is a dramatic benefit to this kind of plan. The other thing is reform actually makes self-insurance more attractive to some employers because what they'll be able to do is when they're healthy, they can self-insure and take advantage of that good claim experience. But if something happens and they're no longer healthy, or they're getting some high claims, they can just transition back into the community rating plan at will. So it removes actually some of the barriers that small companies had to self-funding, because they have a way out without having to be hit really hard on a premium rate up when they do so. So those are some of the basic options, the pay or play options, and what your concerns are with those. However, no matter what you decide, obviously it's an employee-based decision, and how your employees respond to it and how it's communicated is going to go a long way to whether it's successful or not. And we know that as an employer, we have a vested interest in the health and well-being of our employees. If they are healthy, they perform better, they're at work more, they have a higher satisfaction with their job, they stay with us, and obviously if we have a healthy workforce, we can attract more employees to our company. Health insurance is a large part, but it's still a single piece of a competitive employee benefit or a competitive human capital management strategy. So no matter what you decide, there are going to be concerns based on communication. So if you have an exchange-based plan and you're deciding to send employees to the marketplace, the first thing I'll let employers know is the stigma of an employer dropping group coverage or not offering health benefits is history. It's a thing of the past, because the effect of the market reforms basically commoditizes health insurance. What it means is there's no longer a risk of dropping coverage and your employees being denied coverage for a pre-existing condition. There's no risk of dropping coverage and having them wait a waiting period before a service is covered. There's no risk of unaffordable coverage. The whole market has changed. However, this fact needs to be effectively communicated. If it's not, of course, the employees can have a general understanding that, well, you know, my company doesn't offer benefits, so they must not invest in their employees or care about my health and well-being, which could be the absolute opposite case, and is the opposite case in most cases, but the communication is the key. So in order to maintain a productive and engaged workforce, we're going to need to ensure that employees under this type of model don't miss an open enrollment or a special enrollment opportunity. Sean said earlier what the enrollment period is going to be initially. There's multiple communication points during that period and during other life events and things like that that are going to have to be monitored by an employer. Employers need to help employees choose a plan that meets their needs. Sometimes just not knowing about health insurance or carriers or what a deductible is or what a copayment is or any of those things, if these employees go to the marketplace and do that self-service, it's not guaranteed that they're going to choose the right plan for them. It actually is a process that should be made with some professional advice. That can be done through an agent. It can be done through multiple ways, and ED Bellis does help with some communication pieces on that if you're interested. They need to understand the process of enrollment and when effective dates are and things like that to avoid some unnecessary expenses. And as Sean said, they're going to have to be aware of premium subsidy clawbacks. And I'm going to cover just one real fast with you. And that is if an employee is promoted or makes more money, it's good. However, it could put them into a different income bracket in the marketplace. And when they file their taxes at the end of the year, if they had said that they qualified for one subsidy, but their increase in income qualifies them for another, that will be clawed back on their tax return. So actually, if you give an employee a raise that puts them over the hump of one of those subsidies, you'd actually have to bump them up a couple more percent just to take the increase in health insurance premiums and to overcome that barrier. So that's an interesting thing about the law. Of course, as employees make more, they will pay more for health insurance under the exchange-based plan, and there's nothing an employer can really do about that. The other thing I want to share is kind of what the marketplace does and does not do, because there are things that it's good at and other things employers are still going to have to be concerned about. The good thing is employees may be spending less on health insurance because of the subsidies, and they can focus on other aspects of their financial security, and it is in an employer's best interest to help their employees be financially secure and healthy. So coverage in the marketplace will have several weaknesses that can be addressed with employer-sponsored programs. One of those is going to be provider access. A lot of the networks inside of the marketplace are going to be skinny, which means there won't be a lot of access to specialized doctors or a variety of hospitals. They may just have one or two hospitals and a few clinics, and there's going to be, it's predicted that there's going to be a lot of shortage because of the new people entering the marketplace and the demand for services. So employers do have a large part to play there. The marketplace does not provide any help for life, disability. Let me go back here one. For life, disability, or vision, or very little on dental. So all those other ancillary coverages, they're not touched by the marketplace. All your voluntary options, such as your accident plans, your cancer plans, all your AFLAC-type plans, those also are not going to be covered. Another thing is specifically in some areas, people, they don't necessarily need or want to see a traditional doctor. The services that are covered in the marketplace are actually defined and determined by the federal government. And just like normal insurance, they don't include a lot of naturopathic and other type of options that employers can actually help with their employees. And the other thing that I think is a glaring weakness in the marketplace is there is actually no fitness or wellness programs in there. So any fitness programs, nutrition, chronic condition management, stress management, all those type of programs are things that an employer will still have to address to fill in the gaps in the marketplace. So if you do have an employer-based plan where you are keeping group-based coverage, you need to, first of all, be aware that offering an employee that type of coverage does remove their eligibility for a subsidy in the marketplace. So it does kind of drive them back onto your group plan. However, even if you cover your employees, the decision for that employee's dependents could be drastically different. I know it just came out. I know the UPS did it, and now a lot of other large companies, really large companies, are removing spousal coverage from their employer-based coverage and saying that spouses are going to have to find coverage elsewhere. And that is actually because of health care reform. It has removed a spouse as a dependent. So a spouse is no longer considered a dependent under a lot of insurance plans. The other thing is all those other family members may be able to receive exchange subsidies. So if you say, I'm not covering your spouse, that may give that spouse an eligibility for subsidy in the marketplace. Employers need to be prepared on how to answer questions from employees who shopped on the exchange. There are going to be some different conversations in regards to employees seeking coverage for their spouses and dependents and where they go and how much it costs and what the employer can do with that. So we need to be prepared with some good communication on that point. Now we're going to cover some key things here, and specifically with compliance. There is a stepped-up push by the federal government to enforce compliance as a means of funding the law. So it is a measurable increase, and it is purposeful. So we're going to cover some of the compliance concerns on both type of plans. So if all employers, first of all, have to issue a marketplace notification to employees by October 1st, it's really simple, actually, and on the Department of Labor's website, you can download that form and provide that to employees. There is going to be compliance concerns for all employers who have to show reporting requirements, but that has been delayed. You may notice that is a trend. The non-discrimination penalties were delayed. No one really talks about them anymore because they're actually delayed soon after the bill was passed. However, there is a lot of people out there that are hearing things and that see this as going into effect sooner rather than later. And the reason why I bring it up now to you is just so that you can be aware to make some advanced changes in your benefit program in preparation for these penalties, because the penalties are pretty high. There's $36,500 per employee impacted annually, so it's $100 a day per employee. What the non-discrimination rules are is you have to offer all full-time employees the same coverage at the same premium. So if you're classing out employees and saying, here the administrative staff has a health plan, but this type of employee does not. The managers have the health plan, but the line staff does not. All that is going to have to go away here soon. Right now it is turned off, but be aware of that. If you do offer benefits, you will be faced with a few more regulations than if you don't offer insurance. And I say a few more, but I should actually say significant. First of all, there is a new Section 7 of ERISA. It is the healthcare reform provisions, and there is a self-compliance tool on the DOL's website. I could send out the link to that as well, that you'll have to complete to ensure that your plan is in compliance, specifically if you are self-funded. A complete overview of these compliance things in ERISA and Section 7 is out of the scope for this presentation, but it is something that we are prepared to work with business owners on should they choose so. Many carriers' fully insured products have been brought into compliance with Section 7 of ERISA, so that means they are brought into compliance with healthcare reform. However, ERISA is a whole different story, and this is something that is a hot topic right now, because although those plans may be compliant with healthcare reform, you cannot rely on the carrier to produce ERISA compliance documents for your plan. And this is a key point here. Employers of any size that offer any type of health and wellness must have maintained compliance with ERISA. So the reason that no one has heard about this is because there's been a tremendous lack of enforcement of ERISA. But when the IRS was tasked to enforce healthcare reform, they really kind of made a little bit of a stink and said, the Department of Labor is supposed to is supposed to, make sure ERISA compliance and enforce that, but they're not doing that. So why do we have to do healthcare reform? So the DOL ponied up, and they have decided they are going to enforce ERISA. So right now, there's not a lot of talk about it for small employers, but actually, it's coming. 95% of all employers are found to be out of compliance with this law, and the Department of Labor is dramatically increasing the number of compliance audits. They are committed to auditing every employer by 2018. They've opened up new regional offices and hired 3,000 new agents. Some of the states where the DOL is already fully staffed are going to be first in line, such as California and Texas. And audits are being initiated via email with no further notification before penalties start to accrue, which is 10 days. So I do have some more information on this. It's something that we need to, every employer that offers a plan is going to have to do. It's not extremely costly to do so, but it must be done. Okay, kind of finishing up the rest of the presentation here for my part. This is actually pulled off of healthcare.gov. It's a useful site to go to if you want to look at your first look at the marketplace. And it kind of goes what the employees are going to see, where they create an account, apply, pick a plan, and enroll. It's going to be a pretty easy process, I would think. However, they are going to have to be prepared with a number of documents. On that site, healthcare.gov, there is this marketplace application checklist that may be handy to give to employees. It shows them all the information that they will need, and then shows them down here. Obviously, there's just a little bit of information about the employee, but the government wants to know a lot of information about the employer down here and what type of plan that is being offered. So that may be your first taste of what it's gonna look like. Moving on here, I will turn it back over to Sean and let him complete some of the timelines and things that you should be thinking about and questions to ask your broker and some mistakes to avoid.
All right, thanks, Brian. Great job covering a lot of ground this morning. And let's get into some key dates that I'd like you to be aware of as a business. And this is coming from the transitional relief documentation that the government released after the pay or play delay, as I call it. And we're still waiting the final documentation, but this three-page documentation kind of gives us an idea of these key dates that I want you to be aware of. And obviously, number one is October 1st, 2013, and I think we've touched on that several times here today. That's when these new marketplaces are supposed to begin. It's the kind of the D-Day for the Affordable Care Act. If they're going to make this thing happen, they're going to have this thing at least open on October 1st. And so that is really when you're going to see more and more employees start to pay attention. You're seeing a lot of promotional efforts all over the country. Some people are wondering if it's going to be called Oprah Care because she's putting her firepower behind it. And it's just going to be all over the news October 1st. And that's when the open enrollment again begins. And you're going to have employees that will probably be coming to ask you about it and trying to get into it. And so that's one of the reasons why it's important to start kind of thinking about these things and preparing yourself for October 1st until January 1st, 2014. It's going to probably be pretty slow, I'm anticipating, this first year. It's going to be all over the news, but I don't think it's going to really kind of get through to the public until next year. And the interesting thing is folks only really have 3 months next year to be able to get into this new health insurance exchange. And so that's kind of what's going to be happening for your employees. Between now and April 1st of next year, you're going to see this big push politically. You're going to see a big push through PR efforts and other things to raise awareness about Obamacare, about these new exchanges, and try and sign up as many people as they possibly can. And I think, as we've covered before, industries that employ people that don't pay as high of an amount, I think those are going to be the folks that are going to be targeted because those are the ones that are going to get the most subsidies under the law. Now, after March 31st, I think, is when it's really crunch time for businesses. And one of the hard dates that I put in for people that I advise is July 1st of 2014. So a little bit less than a year from now, you really kind of need to have a strategy in place. You need to probably, by the beginning of this year, have figured out whether or not you're going to pay or play. And then from there, it's going to become an issue of, all right, how do I measure my employees? How do I make sure that I'm hiring people as part-time if I decide to play, to keep those numbers down? And because once you have that strategy in place, and if you kind of start getting used to these things, measuring your employees, knowing exactly where you are, exactly where you stand, you're going to find that as crazy and grandiose as this law is, many folks are not quite in as much problem as they are. And when that official employer report comes, which I talked about earlier, tax season 2016, you will have an appropriate process in place. So to review, important dates that you need to be aware of are October 1st of this year, January 1st of next year, the end of open enrollment next year, because that's when employees can go in and out of the exchange, and then January 1st, or July 1st, 2014, because that's when I believe you should probably have your decision made up and your strategy in place moving forward, because I just don't see another delay. Next slide, please. This is these next few slides are going to be some questions that I think you should ask your broker, and I'm going to talk about, when I conclude, kind of the 5 approaches that businesses all over the country are taking to deal with this issue. And one of them is relying on the broker or an insurance carrier if you already have one. And they can definitely help answer a lot of your questions. But here are some of the ones that you should be asking them, because they do have a conflict of interest in some ways in some of the advice that they're asking, because obviously they get compensated for having a group plan. So what you need to ask if you have a current plan is, will this plan be in compliance beginning, next year under this new normal? Brian touched on it earlier, but these new plans have to meet these new standards under the Affordable Care Act. And what we're seeing is there's going to be some rate shock, and some of these plans might have to change. And so you need to make sure that if you are offering coverage, you're offering something that's not going to put you in a difficult position next year. Another question that's important is, do I qualify for the small group market or the large group market? And that is going to vary by your state, but it's also going to determine how this law impacts you, because there are some provisions under the Affordable Care Act that only apply for small group market, which is under 50 in some states, and some states it's under 100. And a lot of the clients that we work with that are kind of right in the wheelhouse of struggling to understand the Affordable Care Act are kind of right on that line. So you need to make sure that they're on top of that issue. How much should I be budgeting for health insurance premiums? Or if I decide to pay the penalty, how much should I be budgeting for that? And if I decide to pay the penalty, how do I make that number obviously as small as possible? One of the things that's important to know is that age banding, Brian touched on it earlier, is going to have an impact. So if you employ a younger workforce, you could see premiums go up disproportionately. And if you employ an older workforce, you might actually see them stay the same, but you should have an idea, and your broker should have an idea on how that's going to play out for you. Next question. Next slide, please. Here's another good one. Brian touched on it, and that's the issue of some of these voluntary things. I think a lot of experts, as they dissect the Affordable Care Act, wonder how this is going to impact healthcare providers, and therefore how is it going to impact patients? Will there be less wait or more wait time? Will it be difficult to access care? There are incentives driving networks to become more, exclusive or selective, creating called skinny networks. And so, are there other products out there like telemedicine and other things that might be integrated that could help be attractive to my employees, especially if you decide to drop coverage, and that, again, may make sense for you depending on your situation. Finally, what do I need to do to make sure I'm not getting hit with that non-discrimination? And Brian did a really good job of explaining it. but a lot of folks could find themselves in a difficult position if they're not understanding that you can't really carve out certain employees anymore, and that's a really big change. And again, it's delayed, but it's important that you're not offering a plan that could, be problematic should they change that. Next slide, please. 10 mistakes I believe businesses are making, and I'm going to kind of tie this into a movie. I don't know if you remember the Cuban Missile Crisis. There was a movie with Kevin Costner. He's in it, and it's the JFK and his brother Bobby. And when they figure out that the Russians are putting missiles on Cuba, that Bobby Kennedy says, there's 5 things we can do, and the first option we can do is do nothing. And I think a lot of people might eventually do nothing with regards to this law, and I think that's a big mistake. And I think avoiding the challenge is something that you shouldn't be doing. I think the other thing that's difficult as well is making a permanent decision based on something that is still being written. The first thing you need to be doing is educating yourself, trying to figure out exactly where you stand, not relying on the media, mistake number 3, because that's a problem. Working with a team of professional advisors, including your broker, but also asking your CPA their opinion, your attorney, your home offices provide good information on this as well. Because drastically cutting hours, which is what approach a lot of people are doing, might not necessarily be something that you need to be doing. You could be replacing workers through attrition as part-time. There are other strategies than just drastically cutting hours without understanding the whole situation. The back 5 mistakes that I believe people are doing is not doing the full analysis. And you see a lot of quote-unquote healthcare experts out there offering free pay-or-play analysis, and they may just provide access to a forecast on how it might impact the company's bottom line, but they don't understand how it's going to impact the workforce of the company, how everybody's employee is going to be impacted. What is the philosophy of that company? Why do they offer benefits? I think all of those variables really need to be considered, and so therefore not doing a full analysis, I believe, is a mistake that many businesses are making. Another one is not having a dialogue with employees. Listen, this is kind of setting things up to make employers kind of be in a difficult position, because in the past, if an employer had offered coverage, it was on the employee to come to them to sign up, and now that is completely shifting that responsibility on the employer. And so I think having a discussion about this, don't be hesitant to say, hey, listen, the government is making us do these things, because I guarantee they're setting employers up to be kind of the bad guy in some ways, that they're setting things up, and so it's important to be proactive with your employees on this issue. Hiring full-time without an analysis, I think some people are just randomly hiring people because they think, well, this delay is fine, I'm just going to hire them now and then I'll figure it out a year from now. Probably not the best approach. The final 2, not researching a longer plan year option. Might make sense to try and get something renewed this year. Let 2014 play out so you know you're okay, and then renew the following year, 2014, December. And a lot of people are doing that. And then finally, not taking advantage of advances in self-funding. It really depends on your company and the size, but there are some businesses where self-funding makes a lot of sense. And so you should consider all of these things. And you should also consider, finally, I'm almost done, and we'll get to your questions, which I see we have 3 or 4. Educating your employees to be better healthcare consumers. Brian talked about it during, with self-funding, how there's all these different drugs at different prices. A neat exercise to do is to call around to a pharmacy and ask for the same drug at 5 different locations as if you were paying cash, and just see the dramatic difference in prices. So educating people to be informed healthcare consumers, teaching them that it's 10 times more expensive to go to the ER for a sinus infection than it would be to go to an urgent care clinic, and other things, is really how you lower costs and improve the wellness and productivity of your employees. Other strategies I think you're going to see in the future are going to be things like telemedicine. A lot of things anymore can be handled with smartphones, and so I think that could help kind of relieve some of the strain coming to the healthcare system. Next slide, please. My final remarks before we take some questions. It's not wise to be reactive with the federal government, and I think it's important to be seriously considering doing some of this voluntary compliance, voluntarily measuring your employees, making sure that it's going to be okay, because if you do happen to miss something this first year, you're going to be okay. However, the next year might not be, and so making for that smooth transition, I think, is going to save a lot of people. Communicating with your employees ongoing is going to be very, very important because you can control the dialogue doing that way, and I think that's going to be extremely important. And then letting others help you navigate this, ones that kind of understand the big picture, that can give you some objective advice, and not trying to go at it alone, because I've been working on this law for 5 years, and it never ceases to amaze me just how crazy it can become and how things can change. And it is changing and still being written, and so constantly being on top of it is going to be a challenge, but it's going to be important for you to do. So I think that's all I've got, Brian. Should we take some questions?
Yeah, absolutely. We do have some questions that have been submitted via chat, and then we're going to get to those first, and then if we do have some time, we can open it up to some audio questions. So
I got one I can answer.
Sure.
First question is there a time frame for an employee to be considered temporary? If so, can a temporary employee be rehired again as temporary? The answer is for temporary employees, there is an exemption essentially for someone that works less than 90 days. So when you look at the temporary staffing industry, what you're seeing is staffing companies offer employees for 90 days, and then it becomes do they go on to that employer as an employer of record, or do they remain on the staffing company? And it really depends on the staffing company. But the answer is 90 days. Second part, can a temporary employee be rehired again as temporary? And the answer is yes, but it has to be after 6 months. Do you have anything to add on that one, Brian?
No, you did that well.
All right.
Very good. So next question, how are we supposed to help employees when there may be some lack of understanding, obviously from an employer's perspective, and referring to employees to professional help, will that be an additional cost? So what I would say on that is that, as far as, I'll answer the second part first, agents and navigators in the marketplace, there is a place for them, and their compensation is actually built into the insurance carrier's cost. So no matter when an employee would work with an agent, then they would actually get the same cost to them, the same premium, and they wouldn't have to pay any consulting fee or anything like that. That's handled on the back end between that agent or producer and the insurance carriers directly. There is also navigators that can help employees get onto the marketplace, but can't advise them on what plan to choose. And those navigators you may find at your community health centers and various other places that may help your employees enroll. So you can do it without a cost to your employees. As far as in a cost to an employers, there may be a small cost, if there is some documents that need to be created and communicated and things like that. You have anything else to add, Sean, on that one?
No. But that is a very good question, because people probably assume that that's another cost out of their pocket. But it is an important consideration to think about, because if some of your employees, especially those that could be over 30, and a lot of people we work with, sometimes they might be working with somebody that's 50 hours one week, 20 hours the next. Really just depends. And so encouraging some of those people that could be risky or problematic to explore that and work with an agent to get on could actually make that employer's census look smaller this first year. That's why it's important to consider, right, Brian?
Yeah, absolutely.
All right. What's the next question? Should a company start to plan now or wait until 2014? I would honestly very highly encourage begin planning now and continue planning into 2014. This is kind of a process. This has a 10-year implementation, but these next 2 or 3 years are kind of going to be volatile for businesses. And so I think the first thing that I would try and do is knowing exactly where I stand, doing a pay or play analysis, figuring out the decision that I want to make, and then developing an ongoing strategy that includes communication, compliance, and other things. One thing I like to do is a reverse calendar. So if official employer report is 2016, start setting some deadlines, moving back from then. I'm going to have my measurement strategy in place this date. I'm going to have my decision made up on this date, etc. Don't wait.
So should a company start a plan now or wait till 2014? That's a tough one to answer without the specifics. So the answer would probably be yes or no, in my opinion, depending on the demographics of that employer. In general, the reason to establish a plan right now is if your company is at risk of rate shock. So if you have healthy, younger male employees, it may actually be a financial benefit to you to start a plan now that can run you longer into 2014 rather than wait until 2014 and establish a plan that may be based on community rating. And that's a short answer to that, but it does get kind of complex depending on an employer's specific situation. And I'll go right into the next one here. An employee that has an amount designated as insurance in his paycheck, that can be problematic. I know right now some employers are giving employees an amount to go ahead and go buy individual insurance on an individual plan rather than a group plan, and they're using Section 125 to do so, but that is going away in 2014. So for health insurance specifically, it is problematic to put that in there. Obviously, if you're over 500, if you're over a certain amount of employees, you're going to have to put what you actually do contribute towards insurance. But because there's no tax advantage to do so, maybe this employee is doing it based on an arrangement, a family situation, or something like that, and that may be a different story, but should be looked into. So.
If we don't have 50 employees, are we required to comply with the notification deadline of October 1st?
The answer to that is yes. All employers need to provide that document. If you don't provide insurance, it's very simple. If you do, it's a little bit more complex, but still pretty easy. So everyone should do that. It's important not just because it's the law, because it's compliance, but also I think employers do have a responsibility to provide that notice to employees so employees know where they stand, and when they go to the marketplace to sign up, the information provided in that document is going to be very useful to them, and that's what they're going to need to know. So it's a good thing for all employers to do, and I think it's good for their employees as well.
Maybe we can send it out with this presentation.
Sure.
Yeah. So then they just have to mail it to their employees, right? Or hand it to them?
It needs to be distributed in a way that's determined to have a reasonable expectation of reaching every single employee. So
a lot of times work through the payroll company.
Yeah,
is the safest way.
Yeah, there's lots of considerations there. It can be done electronically if every single of your employees needs a computer to do their job. If not, you're going to have to rely on some other means of doing so. Payroll is the most popular.
Cool.
So that concludes the typed comments. I open it up if anyone does have a question. Hopefully, don't get a lot of back noise here, but just open it up for a minute, and if anyone has a question, go ahead and shoot. If not, we'll go ahead and close the presentation.
There's one more that popped up, Brian.
Okay, one more question.
About the notification, there are two options, one if they provide insurance and one if we don't, right? Obviously.
Yes.
So say this person doesn't presently have a plan in place but might intend to. Which one do they have to send out?
they would want to send out the one that they intend to do. So you're going to you're going to want to make that decision for employees by October 1st. So it would be you would communicate the plan or option that you will have in force effective January 1st. Yeah. So that would be the date. So it would be based on the date of the plan that you will have at that time.
At January 1st, 2014.
Mm-hmm.
So if they were going to wait till 2015, then they would just do the one that they're not offering for this first year, right?
You got it. Absolutely.
Okay. Cool. Any other questions, folks?
No, thank you. It's very informative.
Cool. Well, we hope you'll visit our website, Health Reform Explained, and we will send a follow-up with this webinar and those notifications and anything else. Brian, do you have any final thoughts?
Oh, thank you for attending, and we will be doing future webinars, so be looking for them, and we'll keep you informed.
Cool. Thanks, everybody. Have a good day.
Thank you.